Hi, I'm Dr. Joubin Gabbay. I'm a board-certified plastic surgeon from Beverly Hills. Today, we're going to talk about injectable disasters. We're going to go over a topic that is very important to me and something that I think can help you stay safe. Be sure to stick around for the end of the video. We're going to give you my top 3 warning signs that your injections may go wrong. Let's start talking about injectables. We get it done all the time. You see it all over the place. But there's the right way to do it, and then there's the wrong way to do it. Let's talk about that. I want you to know that these are not patients who I have personally cared for or really ever encountered, but their stories are so important in helping you understand what can happen if plastic surgery is done incorrectly, and more importantly, can help you learn how to avoid getting into these disastrous situations. So there's a well-known case of an Instagram fitness influencer, Jenelle Butler, who had butt augmentation done. Now, again, something you see all the time, but the problem with her is that she had it done the wrong way. What happened? So she went to a hotel room and had someone she found by word of mouth inject something, we don't know what, but something into her butt. She did okay for a little while. She got the fullness that she wanted. She was feeling pretty good. But about 3 years into it, she started noticing that things were getting a little itchy. She was starting to get lumps and bumps, and even her skin started to get a little different, a little red. Time goes on, and it turns out that she had a disaster brewing back there. What happened was she had probably something like silicone injected into her butt, and it had a low-level infection that got worse and got worse and got worse. By the time she started to seek medical attention, she had a rip-roaring bacterial infection in her butt around all that stuff that she had injected into her. And she needed some pretty extensive and expensive surgery to take out all that stuff. And they probably didn't even get everything out. So this leads to a really interesting question. You do injections all the time, why doesn't this happen? And also, come on, silicone, plastic surgery is almost synonymous with silicone. What's the problem? When we use silicone in the plastic surgery world, it's usually in the form of some sort of an implant. The best example is a breast implant, where the silicone is in a nice encapsulated shell that keeps everything separate from the body. It's not injected as tiny little droplets throughout the breast tissue, butt tissue, or whatever. And the reason that's important is when the implant is put in, again, with a nice shell around it, the body typically forms a nice gentle capsule around it. The body literally keeps the implant separated from itself. So that's easy, and implants can stay in for years and decades, no problem. The problem is when you inject silicone gel throughout the body. When you inject it, it's injected as tiny little particles that gets meshed in with your normal body's tissues, the breast, the butt, wherever. So at the beginning, almost always, it's great. You get that fullness. Silicone feels kind of natural and everything's okay. But remember how I was saying with an implant, your body forms a little capsule around it? Well, the same thing happens with these tiny little particles. Little capsule, tons of these little capsules. And then it starts creating this inflammation around it. And these capsules sort of form together and they get hard, they cause lumps and bumps. And the scary thing is sometimes one of those little capsules can get infected. The silicone there can get some sort of a bacterial infection. And because it's just deep-seated in your body, it's quiet. But then it grows, and the thing next to it gets infected, and the thing next to it, and next to it, and next to it, and suddenly there's just infection everywhere. The problem comes with treating it. Antibiotics don't always work well for this because the infection attaches to a foreign material that you can't get rid of. If that happens with a breast implant, well, worst case scenario, down the road, you just take the implant out, problem solved. You can't do that when there are tons of tiny little droplets of silicone interspersed all through normal, healthy body tissue, breast tissue, butt, or whatever. Those infections will get really bad. They start smoldering. Everything gets really, really nasty. And then what you have to do is just cut out everything. You gotta cut out all the affected tissue, including the healthy stuff, including the silicone granules. That was exactly what happened in this case. She had a big whack of butt tissue. It was taken out, and she's never gonna be the same after that. Jenelle Butler's case demonstrates problems that can happen with these injectables when they're sort of, the problem is localized, in her case, to the butt. These things don't always stay there. And there are some very well-known complications that extend beyond that local area where the stuff was injected. There's a case of a woman named April Brown who demonstrates how this can become a total systemic problem throughout your body with, unfortunately, devastating results. April met someone in her hair salon who convinced her it would be a great idea to make her butt bigger. Didn't say how, didn't say why, just that it would be a great idea, and she went for it. She had a good result for a while, but that didn't last. Turns out April had some bathroom ceiling caulk injected into her butt. It's not normal, right? No. 7 years later, that stuff in her butt got infected. And again, guys, it's not like a little pimple is right there and you pop it, problem solved. This infection got into her blood. This infection went all over her body, and this infection put her in a devastating place. She was in the ICU, and little by little, her organs stopped working. What happened is the infection started to cause her blood vessels to clamp down and blood flow to stop going to her hands and to her feet, to the point that it was so bad, she actually developed gangrene of the digits and the hands and the feet, and she needed amputations. She ended up losing her hands and her feet because someone thought it was a good idea to inject bathroom caulk into her butt, showing that these products, these things have effects that are far outside of just the place they were injected. Losing hands and feet it's pretty bad. It's devastating, it's life-altering, but it's not life-ending. There are cases where it is life-ending. There is another story, another case of a woman named Tarka Newby who had something, we don't even know what it was, something injected into her butt by a woman known as the Duchess, a woman named O'Neill Morris. And I want to put that name out there because that person needs to be reminded that she killed someone. Tarka was killed by this person because the stuff that this Duchess injected into her, forget about the fact that it was just illegal and a bad substance, and down the road for sure would have caused complications. Well, this stuff got injected into her body and very likely traveled into the big veins in the buttock area and likely went to her heart and lungs and stopped them from working. Unfortunately, Tarka died because of this treatment. The one good thing was that this person, the Duchess, who it seems has done some of this work with serious complications to a number of people, she was arrested. She was put on trial and she was sent to jail for killing this person. This conversation talks about, again, some key points of where these complications arise. There are local complications in the area that it was injected into, but also there are more systemic and distant complications that can happen that can result in disfigurement and even death. I want to point something out. This is very real. This is not something that you just see somewhere on a crazy, Instagram post or somewhere on the internet. I see this stuff all the time, and I will tell you the story of a woman I met who had silicone injections done in Mexico years and years ago. It was done all in the outside of her thigh, all in her butt. Same thing you hear all the time. It went great at first. She was doing beautifully, she was happy, but then things started changing. She started noticing a more lumpy, bumpy appearance. She started noticing itching, and little by little, these little globs of silicone started coming up to her skin, and then they started eroding through the skin. They eroded the skin and tissue so badly, basically everything on the whole side of her butt was completely open and raw and exposed. Do you believe me? Here's a picture. Take a look. It is one of the worst things I've seen, and I will never forget that, and I hope you never forget it, because this is exactly why you got to be careful with the stuff that you do. I still personally don't understand how someone can think it's a good idea to find a random person pretty much off the street and say, hey, just go ahead and inject, I don't know, whatever you want into my body. I don't need to know what it is. I don't need to know how you do it. I don't need to know if you're trained to do it. Just make my booty big. It's the wrong way. Well, what do you do? How do you do this properly? Because, you know, it's one thing to sort of talk crap about these very illegal things, but the reality is, look, people want it. They're doing it for a reason. People want to have bigger butts, bigger breasts, things like that. The better way to do it is possible to use implants in the butt. The best way, though, is to use your own body's good stuff. What we talk about is using fat from your body from other places and transferring it to your butt, so-called Brazilian butt lift. It's basically the biggest lemons to lemonade situation ever. You take fat from an area that you don't want it to be, your stomach or your thighs, your arms, or wherever, and you put it where you want it, and it lives there, and it will change your form, it'll change your shape. These are things that we do all day long, and we do with amazing success. That's a better way to go. All right, guys, thanks so much for listening. This is a really important topic to me. I hope you enjoyed it. And now, as promised, my top 3 warning signs that your injections might go wrong. Number 1, if you're getting it done in a hotel room or in a garage, not a good idea. Number 2, if the procedure or the person who's doing your procedure is not verifiable, if it's someone you hear just by word of mouth and you can't look them up on the internet, you don't see them on Real Self, which is a good database of cosmetic doctors, or other really legitimate, verifiable sources, you're gonna have a problem. And number 3, if they're using something on you that they got from Home Depot, run. All right, guys, thanks so much for watching. If you have any questions, put them down in the comments below. Be sure to subscribe so you can see more of my videos. I look forward to talking to you more. We'll see you next week.